So the DCA that we supposed to get
Yes.
in 50s and 60s,
Yes.
we end up getting in.
Even in adolescents.
Okay, so adolescent, matlab, even in 13, 14 years.
Yes.
Okay.
Like 6 months baby should have monosyllables.
Okay.
9 months baby should have started speaking bisyllables,
Okay.
like mama, papa and all.
Okay.
Number of cases with autism is increasing.
Yes, sir.
Like suppose 1-year-old child came to your OPD.
Yes.
So it should not be just restricted to cough and cold or whatever illnesses. Ultimately, it's going to affect one's mood, behavior, focus, and immunity.
Okay.
Welcome to the Dr. Strange Show, where there's no magic, just medicine.
I'm Dr. Harish Narra, a pediatric resident on a mission to make medicine simple, real, and relatable. Today we have someone truly extraordinary joining us. He's not just a pediatrician. He's a force in the world of child health, a name that carries weight in every NICU and PICU he walked into. One of the brightest minds in pediatric critical care, a man who has stood at the edge of life and pulled countless children back from the brink with precision, heart, and hope. We are deeply honored to welcome Dr. Puneet Jain, sir, DM in Pediatric Critical Care, and also an academic trailblazer, mentor to many, and a clinician whose common crises have saved lives and shaped the future. From managing the sickest infant to mentoring the sharpest young pediatricians, his legacy isn't just in what he does, it's in who he inspires. Today, he is not just here to talk medicine, he's here to bust myths, share truth, and tell us a child's health in modern medicine. Dr. Puneet Jain, sir, welcome to Dr. Strange Show. Dr. Puneet Jain, sir, thank you so much for joining us today. It is an honor to have a person with such an expertise in our show. Sir, before we start talking into science and serious stuff, I would like to ask you some personal questions. May I?
Yeah, sure. Thank you, Dr. Harish, for having me here.
So after your pediatrics, you went on doing pediatric critical care, which is a very high stake branches and very challenging branch. So when many people are going into neonatology, cardiology and neurology, why did you choose to become a pediatric critical care specialist?
Okay, again, that's a very interesting question. So, each and every branch in medicine is unique.
Yes.
There's so many things to do. You can bring the change to so many lives.
Yes.
So, each and everybody has its own interest. So, similarly, I was interested in managing sick cases, as I mentioned earlier.
Yes.
Even during MBBS, I was so much drawn towards sick cases management.
Okay.
So, similarly, here also, in pediatric critical care is definitely one of the most challenging branch.
Yes, sir.
Emotionally, mentally, and technically also.
No doubt about it.
Yes. So, during my post-graduation days in pediatrics, so I saw many sick cases,
Yes.
how they are being managed, and like patients are coming in very sick conditions.
Yes.
Sometimes they are having respiratory failure, they are having cardiac failure, they are having renal conditions, maybe sometimes they are having neurological problems.
Yes.
So, and these patients are being taken on ventilator.
Yes.
And after suppose 3-4 days, they are improving and they are opening their eyes, they are taking their breath on their own. So it's a really amazing experience. And I saw how they are being managed as a team,
Yes, sir.
because management of sick cases require teamwork,
Yes, sir.
meticulous planning, and there are decisions which can be life-saving.
Yes, sir.
And one more thing, when a patient becomes sick, especially a child, there are so many family members are there, mother, father, grandfather, grandmother, and so on.
Yes.
So it's really difficult and challenging to manage such cases.
Okay.
And if you can become part of that team, what can more you ask for, from a God?
Yes.
So it's a blessed thing, it's a privileged thing for us. So that's why I decided to become a pediatric critical care specialist.
Oh, wow. Sir, now we all get to know what you do and why you do and why you choose pediatric critical care. Sir, I don't know how to say this, but I salute you because I have seen you saving numerous amount of lives right in front of my eyes. I have seen you bringing people back to life from the brink, and you were there standing between the edge.
So I'm thankful to you for your expression, but I will mention one thing.
Yes.
It's not only me. There are so many junior residents. There are so many nursing staff.
Yes.
And even class workers. So many team members are there. Because of them only, a patient gets survived or is getting well managed.
Oh, yes, sir.
So it's a teamwork.
Yes, I can't deny that fact, sir. So should we get into main part of the show now, sir?
Yeah,
Because
sure, definitely.
I'm sure many of our viewers, students, and everyone is waiting for this part of the show. So my first question, I want to start with a newborn, sir. Sir, every baby cries. And for new parents, it's like decoding a new language.
Yes.
Sir, how do a new parent can decide whether the child is crying due to hunger, or is it due to some kind of irritation, or is it something serious?
Okay. So, like as you mentioned, baby cries. There is no other mean to express their feelings or their requirement.
Yes.
So cries generally we think as random.
Yes.
So it's not, these cries are not random. There are some messages are hidden behind those cries.
Okay.
So cries can be different types, can be of different types, like hunger cries.
Yes.
So in that, what will happen? Suppose baby has been fed 2 hours back,
Yes.
he will become hungry again.
Yes, sir.
So he will have some like rhythmic cries and some sucking movements will be there.
Okay.
Okay, so these are called feeding cues.
Okay, sir.
Then second cries that's more common in children are colic, because of colic.
Okay, sir.
Okay, sometimes what happens after milk injection, there will be digestion, there will be gas formation.
Okay.
So sometimes baby cries because of that also.
So can I interrupt you for
Yeah, sure.
So what is colic exactly?
Colic is like baby will cry intensely. There will be high pitched cry,
Okay.
and baby will have some intermittent spasmodic movements in abdomen.
Okay.
Okay, so he will pull up his legs.
Okay.
So by this you can identify this is colicky pain or something else.
Okay, sir.
If baby is inconsolable, crying continuously for more than 2 to 3 hours,
Okay, sir.
then it becomes a red flag.
Oh, okay.
So parents should pay attention to those cries.
Okay.
So I can say like cry is basically a way of communication
Okay.
for newborn.
Yes, sir.
And nowadays one more thing I want to add.
Yes, sir. Please.
So previously there were so many joint families.
Yes, sir.
Grandmother and grandfather, they used to take care of all these things.
Yes.
Because they were, used to, they had experiences.
Yes.
But nowadays what is happening, nuclear families are there and parents are not that confident.
Exactly.
So they become more apprehensive.
Yes, sir. I'm sure with this message, many of the new parents out there, so they got so much relieved, whoever is watching this show. When a child falls sick, so every parent worries. Okay. So can you tell us like 5 dangerous signs that no parent should ignore when the child falls sick?
That's a great question. If you're specifically asking for 5 red flags,
Yes.
so I'll mention first with feeding difficulty.
Okay, sir.
That is very important in pediatric age group. Whatever I have experienced, I felt like this is almost in most of the cases this will be the first sign.
Okay, sir.
Newborn babies or toddlers, they will stop feeding or
Okay.
they will have poor feeding, refusal to feed. So this is the first danger sign.
Okay, sir.
Second thing is fast breathing.
Okay.
That is easier to identify. If there is fast breathing or chest indrawing,
Okay, sir.
जिसको नॉर्मल भाषा में बोलते हैं पसलिया चलना,
Okay.
है ना, या some abnormal respiratory sounds,
Okay, sir.
है ना. So this is also a danger sign. Third thing is unresponsiveness or altered sensorium. It means बच्चा जग नहीं रहा है ढंग से या ज़्यादा रो रहा है. So that is also a danger sign.
Okay, sir.
Fourth thing is seizures or abnormal body movements.
Okay, sir.
Fifth danger sign will be high grade fever,
Yep.
persisting for more than 3 days and not responding to medication.
Okay, not responding
Yes.
to medication.
And सबसे important, if any time parents feel or especially mother feels child is not well, so that is the utmost important danger sign
Okay.
and they should take consultation from a doctor.
Okay. So even in absence of all these signs, if the mother feels that
Yes.
the child is not feeling well, they should seek medical attention.
Yes.
Okay. So thank God, sir, but you're here because with the help of this list, they can shortlist majority of the high risk scenarios.
Yes.
Sir, okay. So you had given me 5 dangerous signs, but out of which most commonly I hear from parents is the fever.
Yes.
Sir, is every fever is dangerous, or any particular symptoms associated with fever should be worried about?
Okay. So first thing is that we should try to understand what is fever.
Okay.
Fever itself is not a dangerous thing.
Okay, sir.
Fever is a way of body to fight against any infection.
Okay, sir.
And you can say fever is an alarming sign.
Okay.
Okay, alarm symptom.
Okay, sir.
It tells you there is something underlying thing is going on
Okay.
and you should become alert.
Sure, sir.
But you should not become panicky every time.
Okay, sir.
Most of the fevers in pediatric age group are of viral origin.
Okay, sir.
Right? Just simple fever, cough and cold. And they improve with symptomatic treatment or supportive treatment within 3 to 5 days.
Okay, sure.
So you should not become panicky with each and every fever.
Okay.
But if fever is of very high grade, associated with chills and rigors,
Yes, sir.
or is lasting for more than 3 days,
Okay.
and not responding to medication, or there are some associated symptoms like I mentioned earlier, rapid breathing,
Yes, sir.
unresponsiveness, poor feeding, then definitely it's a danger thing
Okay.
and one should consult a doctor.
Sure, sir. Sir, I have seen there are many techniques in measuring temperature nowadays in the market. See, what is the right way to measure the temperature in a child?
Okay, so I will say the preferred way to measure temperature is thermometer.
Okay, sir.
Nowadays digital thermometer is easily available,
Okay, sir.
and one can use the thermometer in armpit,
Okay.
in axillary region.
Okay, sir.
Okay, so that is easier and socially acceptable also.
Okay.
As such, there are other methods also like rectal temperature, ear temperature, infrared temperature,
Yes, sir.
and so on.
Okay. So, but most reliable is the axillary temperature.
Yes, and easier also.
Okay, sure. Sir, one of the common myths I've been seeing lately in social media is teething causes fever to children. Does teething actually causes fever in children?
So teething per se doesn't cause fever,
Okay, sir.
but what happens at the time of teething, like around 6 to 7 months,
Yes.
babies will be having mouthing and all. They will try to give each and everything in mouth.
Yes.
So associated other things like loose motions,
Yes, sir.
like diarrhea can be there. That can cause fever.
Okay, sir.
Or sometimes some flu, cough, cold are associated with at this age group.
Yes, sir.
So sometimes what happens, parents tend to connect those symptoms with teething.
Okay.
So maybe we can say this is temporal association.
Okay, temporal association. Wow. So, when does fever becomes an emergency?
Okay. So fever, if it is associated with seizures,
Yes, sir.
abnormal body movements or convulsions,
Okay, sir.
okay. If it is associated with rapid breathing,
Okay, sir.
chest indrawing,
Okay.
abnormal respiratory sounds,
Okay.
okay. If fever is associated with poor feeding
Okay.
or refusal to feed,
Okay.
then it becomes emergency.
Okay.
If fever is very high grade, like other symptoms, baby is not passing urine well, or
Okay.
there is some blood in urine
Okay, sir.
or blood in stools,
Okay.
then it becomes emergency.
Emergency.
Yes.
Sir, the way you answered about fevers is so wonderful. I'm sure now majority of our audience have a clarity on what to expect when the fever comes and how to react when the child gets fever. Sir, I think one of the silent fear majority of the parents face is cost of medical treatment. So when it comes to pediatrics, do you think pediatrics treatment is expensive? And how can we make sure that even the child with a poor background should receive a proper treatment or can receive a proper treatment?
So this is a very important question regarding pediatric healthcare.
Yes.
And generally, we don't talk about cost of treatment much.
Okay, sir.
So here in Pacific Medical College, we have built a system with our management.
Oh, sure.
Like no kids should be denied treatment because of cost.
Okay.
So here, everything is free of cost
Okay, sir.
for the patients who can't afford,
Okay.
like admission, investigations, treatment.
Okay.
Everything is free of cost for the parents who can't afford.
Wow.
And this our medical college is well equipped with insurance schemes from both government sector as well as private sector.
Okay.
So we have very advanced neonatal intensive care unit and pediatric intensive care unit,
Okay.
and round the clock team of experts
Yes, sir.
working for the patient management.
Okay.
So here I'm grateful to our management, Shri Rahul Agarwal sir, Aman Agarwal sir, Preeti ma'am, and Sharad Kothari sir, for providing such a advanced system with almost free of cost.
Yes, sir.
So that all patients should get advanced treatment.
All patients should get advanced treatment. Sir, I really love the way they are thinking and I really salute them for the commitment they had taken to dedicate, in terms of providing treatment to the children. Wow. Sir, I don't think this is just limited to pediatric departments. So I think even with the other departments such as general medicine, orthopedics, cardiology, gastrology, and oncology, they have the highest quality of doctors, world-class infrastructure, and no patient will be denied just because of financial reasons. Sir, I want this information to go to every corner of India. Okay. So if you can say this in Hindi as well, sir, and I'm sure this will reach every corner of India, even a person without an educational background will be able to understand this message.
पैसिफिक मेडिकल कॉलेज एंड हॉस्पिटल में यहाँ पर ऐसा सिस्टम डिवाइस किया है मैनेजमेंट ने कि कोई पेशेंट, चाहे से वो प्रिविलेज बैकग्राउंड से हो या रिमोट कोई दूर दराज गांव से है जिनके पास पैसे की कमी है, उनमें से ऐसे किसी बच्चे को यहाँ पे बिना इलाज के नहीं भेजा जाता है अगर जस्ट बिकॉज कि उनके पास पैसों की कमी है. सो यहाँ पर बच्चों का एडमिशन, हॉस्पिटल में एडमिशन एंड दवाइयाँ, जांचें सभी निःशुल्क की जा रही हैं.
ओके सर.
सो एक बहुत ही अच्छी चीज़ है मैनेजमेंट की तरफ से, जहाँ पे कि कोई भी सिक बच्चा बिना इलाज के हॉस्पिटल से ना जाए.
ओके गाइस, शेयर दिस टू every corner of India. We want every child to get right to treatment even without any financial problems for them. After hearing this, my next question is what every parents also they know about it, but they are least understand about, which are vaccines. Sir, can you tell us what are vaccines and what does they do to human body?
प्रिवेंशन इज बेटर देन क्योर.
Yes, sir.
बचाव ही सबसे अच्छा उपाय है किसी
Yeah.
बीमारी से बचने के लिए. So vaccines play an important role in prevention of many diseases.
Okay.
So what are the vaccines? In vaccines, what do? We give some part of that bacteria or virus,
Okay.
inactivated, killed, or some component.
Okay, sir.
We inject or give orally to the baby.
Okay, sure.
Okay. So this will induce a response from a body.
Okay.
There will be antibody production.
Okay.
Okay. So these antibodies will defend the patient
Okay.
from future life-threatening infections.
Okay. So basically, we are giving a part of
Yes.
infection.
Yes.
Okay.
But this is not harmful for the patient,
Okay.
for the children.
Okay. Not in a dose that is harmful.
Yes.
Okay.
It is just like training the immune system.
Okay. Sure.
So in future, it is going to help the kids and parents.
Okay.
So after vaccines, either disease will not happen
Okay.
or it will happen in less severe manner
Okay.
and complications will be less.
Acha. So basically, so they protect immune system
Yes.
and they reduce the severity of disease. Okay. So which adds to another point for me from my side. Because there are so many vaccines. So there are certain vaccines that are given by Government of India and there are certain private vaccines. So are the government vaccines are good enough or should the child be taken? I mean, should the child also take private vaccines?
So first thing is government vaccines.
Okay.
So government vaccines are mandatory.
Okay, sir.
So many of the vaccines are being covered by government
Okay, sir.
schemes and many life-threatening diseases can be prevented or avoided,
Okay.
like diphtheria, pertussis, tetanus,
Okay, sir.
polio, and so on. So many diseases are covered by government vaccines.
Okay.
So these vaccines are definitely must.
Okay, sure.
Coming to the private vaccinations. So private vaccines are basically these vaccines add extra layer of protection.
Okay, sure.
So some diseases like hepatitis A,
Okay, sir.
typhoid, chickenpox, these vaccines are available in private setup.
Okay.
So these vaccines are not mandatory, but you can say desirable.
Okay. So these vaccines are like adding extra layer of protection.
Yes, exactly.
Okay. So majority of the people, I've seen majority of the people and parents thinking that, so after 6-7 years, my child is fully immunized. इसके बाद कुछ vaccination देने के लिए जरूरी नहीं है. So, are there any vaccines that child should be getting even after 7-8 years of age? If yes, what are those vaccines and why should they get them, sir?
Okay, so definitely vaccination doesn't end at 6 or 7 years.
Okay, sir.
So one should definitely get vaccination at 10 years again.
Okay, sir.
So that is like diphtheria, tetanus, and pertussis, DTaR.
Okay, sir.
That is again must.
Okay, sir.
And nowadays, human papilloma virus vaccine is also available.
Okay, sir.
That prevents basically mainly against cervical cancer.
Okay. It's
In girls, HPV vaccines.
Oh,
yes.
sure, sir.
Can be given to boys also,
Okay, sir.
but more important in girls.
Okay.
So they should definitely get HPV vaccines
Okay.
after 9 years of age.
Okay, sir.
And one more thing, if patient is immunocompromised, in the sense he is having some primary immunodeficiency or maybe some conditions like leukemia, malignancy and all.
Okay, sir.
So in those conditions, there are other vaccines they should also receive.
Okay.
Like like pneumococcal, influenza, like that.
Okay, sure, sir. Sir, HPV. So I think there are multiple strains of HPV
Yes.
available. So most commonly I heard is nanovalent and quadrivalent.
Yes.
So which one is ideal and how many doses should be they taking?
Yes. So there is schedule for that 9 to 14 years and
Yes, sir.
15 years onwards.
Okay, sir.
In 9 to 14 years, one should receive 2 doses,
Okay.
6 months apart. And after 14 years, 3 doses are there,
Okay.
0, 2 and 6 months.
Okay, sure. Sir.
So out of these different vaccines, so obviously 9 valent vaccines will cover more strain.
Okay, sir.
So like that one can choose.
Sure. Majority of the parents are worried or anxious about the growth of the child. So see, as I know that every child grows at their own pace. But when do the growth is worrisome, and how do parents identify that, sir?
Okay, so growth and I will say development also. Growth and development are very peculiar characteristics of any child's journey.
Okay, sure, sir.
So talking about growth, so each and every child has its own pace,
Okay, sure, sir.
and there are certain standards are there. Like in a 5 months, what should be the growth? In 1 year, what should be the gain in weight, gain in length,
Yes, sir.
like so on.
Okay.
So for these, we have growth charts provided by Indian Academy of Pediatrics as well as World Health Organization (WHO) charts.
Okay, sir.
So for that, one should have a frequent doctor visits, like every 3 to 6 months.
Okay.
And like I can say till 1.5 year of age, there are so many vaccinations are there.
Yes.
All those visits can be utilized for seeing the growth,
Okay.
and one can plot height or length
Okay.
and weight on those growth charts
Okay.
and can see how's the growth going on.
Okay.
So growth is affected by many factors.
Okay, sir.
So generally parents think this is about nutrition. So nutrition is one of the major factor, but there are so many other things: genetic potential,
Okay, sir.
environmental factors.
Okay.
So all these factors should be taken care of.
Okay.
And when does it become red flag? Is that suppose there is no gain in weight in 1 year. Generally we expect after 2 years of age, like there should be 3 kg weight gain every year,
Yes, sir.
and so on, like increase in height. If any time growth is falling from those charts,
Yes, sir.
there's different centile charts are there.
Okay, sir.
If growth is falling below those centiles
Okay, sir.
or going beyond third centile,
Okay.
below third centile, then it becomes red flag.
Red flag.
Yes,
Okay.
when one should consult a doctor at the time.
Okay. When should parents start to worry about their children's growth?
Okay, so generally what we see in OPD, there is always comparison of kids
Yes.
with peer age group.
Yes.
Like वो इतना बड़ा हो रहा है, उसकी हाइट इतनी है, उसका वेट इतना
हाँ, sir.
है ना. So that becomes major thing for concern.
Yes, sir.
So for those things, one should visit a doctor,
Okay.
see the growth charts. है ना, each and every child is different.
Yes.
So all kids cannot be same. Sometimes what happen, there is a constitutional delay. It means some children, they don't grow that well in the initial age group.
Okay.
But once the puberty occurs, at that time there will be growth spurt.
Okay.
And final height will be normal or according to genetic potential of the parents.
Okay, sure.
So this should also be taken care of.
Okay. Sure. Now, the biggest question, I'm sure every parents should know about this, is the screen times.
Yes.
Sir, I have seen a 1-year kid playing with a mobile, and I have seen a 19-year or 18-year kid hooking up with the mobile the entire time. So, is it right thing to do, or are there any limitations for screen times?
Screen time is become, I think, epidemic.
Yes.
It's a new epidemic,
Yes.
or even say pandemic.
Yes.
It's that great problem.
Yes.
In obesity, we say you have to treat a whole family.
Yes. Yes.
Similarly, here also,
I think none of this generation kids are not even close to these numbers. Sir. I heard it from many parents. My child doesn't sit still, and he cannot stand here. He keeps on jumping. Is it a normal behavior of a child, or associated with something serious like ADHD? So what are the red flag signs in developmental delay? How do parents should identify it? Junk food, sugars, and sweetened beverages. So what are these going to do to child's health, sir? So when we try to take away the screen off from the child, and the child will start throwing the thing, starts crying, shouting at people, these tantrums. So without having any of these tantrums, how can parents control this screen part, sir? Without even they're realizing it. What are the harmful things they pack in their defense for the children?
The Dr. Strange Show, where there's no magic, just medicine.